Did you know that 125 million people globally suffer from psoriasis today? Hi, I'm Dr. Angeline Yong, a dermatologist, and welcome back to my channel. In this ensuing video, we'll be talking more about psoriasis, which is a chronic, scaly, inflammatory condition that can be chronically relapsing and remitting. Let's dive into some of the most common triggers that can give rise to a flare-up of psoriasis. Number one factor is stress. While stress is not completely avoidable, stress is a part and parcel of our daily lives, and learning some stress management tips can be helpful because stress is known to trigger a rise in cortisol levels, and this can also give rise to a disruption and flare-up of psoriasis. The second thing would be actually injuries. Psoriasis is a skin condition that is known to Koebner-rise. By the word Koebner-rise, we mean that when you have an injury like an insect bite, a scratch, a surgical wound, or some form of trauma, psoriasis can actually flare and localize to that area of injury. Thirdly, we talk about medications. So in psoriasis, it is known that certain medications can trigger or worsen and aggravate psoriasis symptoms. Some of them include beta blockers, antidepressants, and non-steroidal anti-inflammatory drugs like ibuprofen, for example. Next, there is also weather. Typically, psoriasis gives rise to chronic, dry, scaly patches. So when the weather is drier, for example with low humidity, it can also worsen psoriasis and make the skin dry out even more, especially if you don't take good care such as moisturizing your skin. The other thing that's really important is the diet. Of course, we know that processed foods are not healthy, but also things that are inflammatory such as dairy, sugar, and gluten may also aggravate psoriasis symptoms as well. We also have very important factors such as alcohol and smoking. Now, smoking can aggravate or worsen psoriasis symptoms, and so can alcohol as well. So try to keep this at bay because it's also not good for general health. We also have infections that can also aggravate psoriasis symptoms. Just like other chronic inflammatory skin conditions like eczema, when your immune system is triggered and dealing with an infection, this can also give rise to an imbalance in the immune system, and the inflammatory condition can flare up or worsen. Finally, hormonal changes. So women may also experience flare-ups around your menstrual cycles or near menopause as you go through hormonal fluctuations. Again, the body will respond to that, and the inflammatory condition like psoriasis may flare up as well. When it comes to identifying triggers, it's important to also first start with self-monitoring. So it's helpful to keep down a diary, look out for things that might aggravate such as certain foods, certain diets, and certain lifestyle changes around you, and certain habits that may be linked to your psoriasis flare-ups. So it's important to monitor this over a period of time and then take this to your practitioner or your dermatologist and discuss this further. So with this background information and you consult your dermatologist, they may be able to go through certain risk factors and certain trigger points with you and may order certain additional tests. For example, certain blood investigation can be carried out if they suspect certain things such as more inflammation that may be in the body that may give rise to a flare-up of your psoriasis, and may order some inflammatory blood tests. They may also be looking for underlying infections, or maybe looking for hormonal imbalance or mineral deficiencies, for example, if that's suspected in your history. The second thing that they may look out for is to do a skin biopsy. This is especially useful if psoriasis is a diagnosis in doubt. For example, sometimes psoriasis may be really small, really patchy, and may not look like typical chronic plaque psoriasis, which is very classical. In these cases where there is reasonable doubt, the dermatologist may want to order a skin biopsy to confirm that on histology before proceeding with further treatment. Finally, the dermatologist may also try a food elimination diet with you. By looking through your diary and seeing what you typically take more foods of around the periods of flare-ups, they will be able to help you decide what to streamline on, and then they may also try to eliminate one by one and then also reintroduce them if they are found to not help your psoriasis management. Remember, there is no gold standard test to help identify what triggers or aggravates your psoriasis. Many times it's not just one factor, but maybe a combination of factors in your lifestyle that may be aggravating that. And during this patient journey, they will help you better elucidate and understand what is causing the trigger point so that you can make better changes to your lifestyle as well. Finally, once you've identified what are the likely trigger points, you can take better steps to better manage them. Firstly, when we talk about stress, of course, it can be cognitive behavioral therapy, but simple methods can also include deep breathing exercises, regular sleep, yoga, meditation as well. Secondly, we also talk about skincare. Because psoriasis is typically dry, scaly, and flaky, it is good to incorporate good skincare habits such as a gentle cleanser, keep showers to cool, shorter showers as well so you don't over dry your skin, and also moisturize. Third, if you suspect that diet is a major part of your psoriasis flare-ups, then it's important to eliminate certain food products that may be causing aggravation. This can be processed foods in some individuals or certain foods that are pro-inflammatory, such as dairy, sugar, or even things like gluten. It's also important to bump up foods that are rich in antioxidants, take more vegetables, take things that are high in vitamins as well. They can be very helpful at improving your overall skin health. Next, you can make some lifestyle changes. So if you do smoke, try to cut back on that. If you take alcohol, also try to reduce that as well. Make some changes to these habits and your skin health might improve, and thank you for that. We also have sun safety because, again, remember to use your SPF at least 30 to 50 because regular use of sunscreen also helps to prevent sunburns, which can aggravate psoriasis because with sunburn, psoriasis can flare up as well. Finally, maintain healthy habits such as regular sleep. A regular sleep cycle helps to minimize stress hormone levels rising. Also keep to good hydration, drink enough water, and also moisturize your skin. Even with trigger management, psoriasis still requires the care with medications in order to mitigate some of the symptoms and also help to control your psoriasis flare-ups. Discuss this with a dermatologist because there's a range of treatment modalities available. Looking at the pyramid, the base would of course be topical management, especially in milder cases. When the body surface area involvement is less, then topical management may be the mainstay. This can of course include the use of certain topical corticosteroids of different potencies and different strengths in different locations that are appropriate for the skin thickness and the severity of the rashes. Vitamin D analogues like calcipotriol are key cornerstone treatments also involved in the management of psoriasis. Next up the ladder, we have phototherapy, which is also very well established in the field of management of psoriasis. Your dermatologist may order a series of treatments with narrowband UVB or even PUVA, which is also utilized for psoriasis. Finally, at the very apex are what we consider systemic therapies. This may include oral medications and/or injection form of medications. Under the oral medications, typically there are some O-class medications such as methotrexate that are very well established in the management of psoriasis. And then of course, in the recent years, there's been more breakthroughs in psoriasis management with what we consider biologic therapies. And this field has been very promising and exciting as we get better and better biologics with better safety data and more longer remission to manage your psoriasis as well. Typically, these are meant for more moderate to severe psoriasis because the surface area involvement is extensive. These are injections that can actually really help to melt away the psoriasis and keep it under control. These biologics are basically very targeted therapy. They are actually molecules that actually shut down certain pathways in psoriasis in order to better manage your symptoms and flare-ups. These are also not immune suppressive by nature, so typically they are much safer than the O-class oral medications that were utilized in psoriasis management. By understanding your psoriasis triggers, you are better managed and equipped to control and alleviate these symptoms that can be pesky and also affect your daily living. If you have any questions, don't forget to seek consultation with your dermatologist. If you like our content and find it informative and would like to learn more about dermatology as a whole, don't forget to like and subscribe to our channel.